India is celebrating 75 years of its independence. We have come a long way in the matters related to health, nutrition, hygiene. What we look at in different parameters, how India has progressed in 75 years. Grossly talking about the life expectancy at birth. When India got independence in 1947, our life expectancy at birth was 32 years. Today it is 70 years. To be precise, for men it is 69 years, for female it is 71 years. And if we look at other parameters, for example, our birth rate, our growth rate, our death rate. I remember I was traveling with Srimati Indira Gandhi in 1981 to Geneva for World Health Assembly. And that time she spoke that India's birth rate is 40, that is 40 per thousand, death rate is 18 per thousand, and growth rate was 2.2% or 22 per thousand. And from there, we have come a great way now. Our India's current growth rate is just 1.1. So, in just matters of 40 years, we have come a long way with 1.1 growth rate. We need to be somewhere better. But still, if you look at our current birth rate, which is 18.2, our death rate is 7.3, and our growth rate is 1.1. Now you look at some other parameters where we would like to see there should be one planet, one health, and one future. In that sense, if you look at public health spending, I remember 1985 when I started talking about the health spending in the country. It was 0.3%. Currently it is 2.1%. So 7 times more than what your healthcare spending was there. And we look at healthcare infrastructure. There were only 50,000 doctors for a population of 35 crore people in 1947. We have currently 12.5 lakh MBBS doctors, 4.5 lakh postgraduate doctors, to total 17 lakh doctors. At that time we had 10,000 people will have one doctor. And our target was to have one doctor for 5,000 people in 1981. Currently we have one doctor for at least 1,000 people. Yes, there are discrepancy between urban and rural. There are discrepancies between tribal and non-tribal areas. Healthcare infrastructure is better in the urban areas. But we need to look at how we have achieved this. We have primary health centers, we have primary health care, secondary health care, tertiary health care. Tertiary health care is more in the cities, and primary health care is more in all over the country, but even in the rural areas through primary health care centers, sub-centers, and community care centers. And we have Asha and Anganwadi worker. They are the backbone of our primary health care. Now we should also look at the parameters, how we achieved all these goals. First and foremost important is elimination of some of the diseases which are vaccine preventable. We eliminated polio, we eliminated smallpox, we eliminated to a great extent tetanus, which is maternal as well as neonatal tetanus. Mothers and children used to die of tetanus. So, and that is all done because of the excellent coverage of immunization. We look at now maternal and child health, our antenatal clinic, our immunization in antenatal period, our deliveries which are now more institutional than the home deliveries, and care of newborn. So we have achieved a fairly greater deal in this field. Family planning, it was a kind of a stigma initially during 81 to 84, 85, and thereafter it was an uphill task to have a family planning discussion. So we started a program called Family Welfare. And in that we have also covered, we brought down the total fertility rate, and through which we have also achieved the population control. We have Jal Jeevan Abhiyan, we have Swachh Bharat Abhiyan, we have Ayushman Bharat. I remember in 1960s when I was very young child, Roti Kapda Makan used to be the main discussion everywhere. Never ever would discuss either education or health. And now health has become a very important aspect. COVID-19 has taught us further that health is very important, and healthcare preparedness is more important. So if your infrastructure is well, infrastructure by way of facilities and by way of human care, if that is well, then we can take care of any problem, whether it's a COVID or any other problem which comes our way. And we also look at at that time, the 40 million currently 40 million children are malnourished, 25 million children are stunted. So our priority is also to look after children and our next generation of future generation. And probably in next year or two, we will be able to achieve those goals also, because now people realize the importance of health. Our other important issues are currently HIV, tuberculosis. We have seen to it that not only India, through India, 80% of the global community gets anti-HIV medicine and anti-TB medicine at pittance of the cost, and which are the most quality medicines. So as far as medicine is concerned, pharma is concerned, or our immunization is concerned, India is the global capital for immunization and pharma. So 80% of the global immunization, vaccines and pharma needs are taken care of by India. So India doesn't only look after itself, but it also looks after the entire world under the tagline Vasudev Kutumbakam. The whole world or whole globe is a family.